Well, Montefiore Medical Center is already renowned for its diabetes services, but now the Bronx Hospital has expanded with the clinical diabetes program. The new division provides patients with increased access to treatment and management programs that have already proven to work successfully. One of the many highlights is the outpatient element, created to help patients' plans and plenty of support. Here to tell us more about this new program and what else Bronxites can do to actually lower their chances of being diagnosed with diabetes is Director Dr. Rita Louard. And we thank you so much for sharing with us.
Thank you for inviting me.
Glad to have you. And we do know that this is Diabetes Awareness Month.
It is.
So for somebody who may not even know, let's just start with basics one-on-one. What is diabetes?
So diabetes is a metabolic condition in which people have higher blood sugars because of any number of reasons. One of the more important ones is that they don't make enough insulin, but sometimes people just don't respond to insulin because they gain weight, they're inactive, and therefore their blood sugars can also rise.
Mm-hmm. So when diabetes is out there, people were wondering, it's the be-all to end-all? No, it can be treated.
It can be treated, and this is a wonderful time. Not that there is a great time to have diabetes, but we have great medications for the treatment of diabetes. We have choices for people that we didn't have, let's say 10 or 15 years ago. And we know the value of lifestyle, that if people exercise, if they diet, that all those medications work even better.
Let's talk a little bit about Montefiore Medical Center and the work that you guys are doing as far as diabetes, because you guys already have, as we said in the onset, a well-known program that deals with it. Recently, you guys have expanded to do a little bit more. Share with us a little bit about programs and services that are available to those persons with diabetes.
So we have programs not only at the Montefiore Medical Center, but also in the community that focus on diabetes education, that focus on diet and exercise, that help people to get more active. So we have programs that not only are within our medical center, but we're trying to do more outreach. And actually, Diabetes Month is one of those times that we can showcase all the things that we're doing for people in the Bronx in terms of diabetes education and awareness. We have this wonderful little brochure. I love this. It looks like a subway guide that opens up and says, this is what we're doing about diabetes in the Bronx, and that you can do Zumba, you can do other things that are not only fun, but get you to move.
You put up Zumba. What does Zumba have to do with diabetes?
Well,
I'm so glad I asked.
Well, I'm so glad you asked. So one of the things people need to do to prevent diabetes, and as well as one of the treatments, is to be more active. And I think a lot of times people say exercise, I have to join a gym, I have to, you know, something I really don't want to do. But the activity can be anything. So if you like dancing, dancing can be your exercise. Zumba classes kind of involve a little hip hop, a little Latin beat. It's a way of getting people up, moving, making a little bit of sweat so that they can prevent the weight gain and some of the other things that can lead to diabetes.
So as throughout the course of the month, obviously there have been a lot of activities that people can participate in at home. Talk about checking and getting stuff together. How do people, first of all, make sure to check for diabetes? How often should they be checking?
So we're recommending, the American Diabetes Association, that people get checked, particularly if you're high risk, at least once a year. And that can be a routine blood test. You go to your doctor, they will check your blood sugar and see whether it's in a good range, or check a test called the A1C, which gives us an average over the last 3 months. So that should be part of everybody's routine health care, that they get checked. But the other things that people can do once they develop diabetes, or if they're at risk for developing diabetes, is really start to focus on that healthy lifestyle. That doesn't mean that you have to give up everything, but it does mean that we're thinking more about portions, right? That Thanksgiving doesn't have to be loading up on the sweet potato pie. It can be just that slice. And maybe walking a little bit over the weekend.
So a couple of things that we could do. You don't have to give up all of your Thanksgiving meal. You can just make some modifications. Modifications, keyword. Modifications.
So one of the great modifications is to, if you're going to load up on something, load up on vegetables. You know, you can do the greens. You can do the string beans. You can have half of your plate with vegetables and the other half with the other stuff. So there's many ways to get through Thanksgiving without increasing your blood sugar or gaining weight.
So we want to tell you, if you want to take part in any of these programs, Montefiore Medical Center is available. What do they do? How do they go about it? Go ahead. And there's also these free pamphlets too. Yes. You saw the information at the bottom of the screen, which gives you the information that you can do. Now, do you have anything else? What else is up on the quick radar coming up down the pipe?
You can always come walking with your diabetes team. We walk around the Oval every November at 12 noon. It's fun. So just, there are many things that you can do, and you can contact Montefiore. We have a website that will allow you to take advantage of all these activities.
Well, thank you for coming and sharing a little bit about awareness, and hopefully
Thank you.
people will just not just take advantage of the opportunity and do something about it.
Yeah, I like that.
I know, and she's encouraged us that we can have Thanksgiving and have a happy one. Just have to make some modifications. So make sure that you make some modifications. Dr. Rita, thank you so much for coming.
You're welcome.
Glad to have you.